Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. And because of your demands, I'm making a video on fungal skin infections. A lot of people have demanded for this topic, and as you know, I make videos about health and healthcare topics, and all my videos directly referenced from internationally accepted US National Medical Library. So that's why you can trust this information. So today, this is a very huge topic, fungal infections, but I'm going to give you an overview, a speedy view of fungal skin infection, because fungus can actually infect anything, anywhere in your body, because fungal infection can actually occur inside your body as well. So today I'm going to talk about fungal skin infections, superficial infection. We are going to know the overview of this condition, why they are caused, and what can you do about it. So let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, fungi usually make their homes in moist areas of the body where the skin surfaces meet. That is, between the toes, in between the genital areas, under the breasts, right, and armpits. So these are the common areas where the body surfaces meet together and they have moisture. So moist areas, body surfacing meeting, no light exposure, fungal can grow there, right? Common fungal skin infections are caused by yeast such as candidas or malassea furfur, or sometimes they are also caused by dermatophytes. So either yeast or dermatophytes like epidermophyton, microsporon, or trichophyton. These are basically medical names, but for your purposes you can remember yeast and dermatophytes. All right. So many such fungi actually live right on your body, right? They live on the topmost layer of your epidermis, your body's skin. The epidermis is the toppest layer of your skin, which is also called as stratum corneum. So they live over it and do not penetrate any deeper, right? Obese people are more likely to get these infections because they have excessive skin folds, right? They have skin folds here, skin fold here, even the neck, everywhere. So excessive skin folds, more chances of fungal infection, more chances of moisture in the skin fold. So if the skin within a skin fold becomes irritated and broken down, it increases the chances of fungal infection in these obese people. Then people with diabetes, they tend to be more susceptible to fungal infections as well, right? But strangely, fungal infections on one part of the body can cause a rash on other part of the body that are not infected. For example, a fungal infection on the foot can cause an itchy, bumpy rash on the finger. Fungal infection on the foot may cause an itchy, bumpy rash on the finger. And these eruptions, these rashes, are basically allergic reactions to these fungi, and they do not result from touching the infected area as mostly believed. These are basically allergic reactions of your body. Mostly these are seen as a reaction to dermatophytids because they identify, the body identifies it as a id reaction, as an allergic reactant. So how do you diagnose? So how do you diagnose a fungal infection? The most confirmatory diagnosis is by skin scrapings. The small part of the skin scrap is taken and culture is done to grow the fungus. That's the most confirmatory diagnosis. Otherwise, Many dermatologists, most of the times, can actually just look at this lesion and tell it that, and tell you and straightforward tell you that it is fungal or allergic, right? So a doctor can suspect a fungal infection when they see a red, irritated or scaly rash in one or more commonly affected areas, right? And they can usually confirm the diagnosis by scraping off a small part of the skin and having it examined under a microscope or placed in a culture medium, right? So KOH mount is also basically a microscopic mount in which we look at the fungus, right? Then what is the treatment? Generalized. Generalized way, obviously you need antifungal medication. Local, local or systemic. You can be given antifungal medication to eat, or you can be given it to apply to that area, right? And the second biggest treatment is prevention of moisture, measures to prevent moisture. So, but most commonly, fungal infections are treated with antifungal drugs, usually applied directly to the affected area. Topical drugs, these may include creams, gels, lotions, solutions and shampoos. And if these things don't work, then the doctor might give you antifungal drugs to be taken by the mouth. In addition to these drugs, people may use measures to keep the affected area dry. For this, right, for this purpose, they can actually apply powder, talcum powder, or they can wear open-toed shoes or loose clothes to actually allow the air to go inside and avoid moisture. For some infections, rarely, sometimes doctors have to give steroids, corticosteroids, to relieve the inflammation and itching. As I've already explained in the steroid video, steroids are dangerous stuff and should be given only by a doctor. So this is basic overview about fungus, and many times fungal infection can spread and reoccur. If fungal infection is reoccurring, immunity check can be done, or hygiene. A hygiene check or an immunity check needs to be done. Either your hygiene is not good or your immunity is not good. So these two things needs to be done, or you did not complete your treatment. So that's all about fungus, or that's all. So that's all about fungal skin infections in short. Hope you liked the video. Tell me in the comments if you want me to make a detailed video about any specific fungal infection, and don't forget to hit the bell icon, because only then you will get the notification of the upcoming video. I'm Dr. Paramjeet. I'm a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR, and this is my channel where you get authentic, simplified medical information. So don't forget to share this channel and promote this video as much as possible. Stay connected, guys. Stay healthy.